The Chief of Staff of the Sultan's Armed Forces stressed that the armed forces are exerting great efforts to support the main committee dealing with COVID-19. He added that the Royal Army of Oman is prepared to provide all support to health sector in addition to rescue and security aspects. He also talked about the medical services provided by the armed forces as well as activating the field hospitals plans according to the situation at hand. The future said that all the military apparatus are well prepared and capable of performing their duties to provide support when needed. The Muscat municipality continues its efforts to spread awareness messages on the necessity of adhering to the instructions of the Supreme Committee of dealing with COVID-19. In that regard, it continues its operations of sanitizing the markets and public places as precautionary measures to prevent the spread of germs and pollution that may lead to the spread of COVID-19 in general. It's worth mentioning that some chemical solutions such as Clorox and Dettol from the experiments of some countries are proved to be effective against combating COVID-19 spread. Worldwide infections from the coronavirus are soaring as healthcare system exerting its level best to deal with the most important areas is people. But the most important people support to follow and implement all instructions issued by the Supreme Committee. More details in the following report.
All around the globe, people are gravely concerned about the fast-spreading coronavirus. People are at home, isolated from friends and loved ones to fulfill social distancing requirements. While at home, they need to be vigilant to protect themselves and having an optimally functioning immune system. But first and foremost, follow national guidance for preventing COVID-19. Avoid spreading virus and cut your chances of catching it by regularly washing your hands, avoiding touching your face, nose, and reducing social contact. This is particularly important for protecting at-risk groups, including people with existing health conditions, the elderly, and pregnant women. As well as protecting yourself on the outside, you can also build up your defenses from the inside by strengthening your immune system.
As of this time, there is no particular research that has been done in combating the coronavirus with nutrition. But a well-balanced diet, according to medical literature, has been demonstrated time and again to improve one's immunity. This is particularly important for the elderly, children, those with immunosuppressants, and those with uncontrolled blood values. Some of the nutrients that have been implicated in improving immunity include vitamin A, vitamin C, vitamin E, and minerals such as selenium, iron, and zinc. Vitamin A, for example, forms the cell barriers in the skin, the respiratory tract, and the digestive tract. Plus, it forms antibodies to ward off infection-causing pathogens. Vitamin A is normally found in salmon, kingfish, nuts, seeds, whole grain, and legumes. Beta-carotene, which is converted to vitamin A, is also found in carrots and pumpkins.
What do we need to feed our body with to help us be in a better health?
Vitamin C and E, for example, help cells in protecting them from free radicals, of which contribute to oxidative stress. Vitamin C-rich foods include citrus fruits, berries, broccoli, and capsicum. And vitamin E-rich foods include seeds and vegetable oils. So make sure that you incorporate these in your meals at home. Excessive simple sugar consumption, those that are normally found in sugary beverages and commercial sweets, as well as processed and fast food, can have a detrimental impact on the immunity. So my advice is to always look for natural means to satisfy your sweet tooth. Use, for example, honey or date syrup or any fresh fruit juice when preparing desserts instead of white sugar. Drinking enough fluids along with regular servings of fruits and vegetables ensures a good amount of electrolytes and minerals consumed, and the fiber in such foods helps to cleanse the colon. Those who are diabetic need to follow the advice given by their dietitian or physician to have their blood glucose within normal range and to consult their healthcare professionals on supplements. And if one smokes or drinks alcohol, the bottom line is to quit now, as these depress immunity. Children need to eat a balanced diet as they are at a growing age and their organs or tissues are developing, so parents are reminded to have a balanced diet provided and encouraged at home. Make sweets only a treat once in a blue moon. I would also like to address practicing basic food hygiene at home when preparing meals. To choose raw materials carefully and watch for food labels, date of production and date of expiry. Make sure that perishable foods are stored safely in refrigerators and freezers and consume at the earliest. Make sure as well that animal protein sources are cooked thoroughly before serving to avoid foodborne illnesses.
Your immune system needs fuel, so avoid intra-low carbohydrate diets. In addition, drink lots of water and keep following precautionary measures as emphasized by the Supreme Committee. Stay fit and healthy at home. Oman and the world needs you. Abdullah bin Ahmed Al-Rubai, Sultanate of Oman Television, Muscat.
Indeed, stay fit and healthy at home and try to have a quality food to improve your immune system. Nurses, along with other healthcare teams, are putting their efforts in the fight against the coronavirus. With us live on telephone call is a member of a nursing association, Oman Nursing Association, Salma Salim Al-Yaqoubi, head of nursing in Ibri Hospital, to tell us on the efforts exerted by the healthcare institution staff on dealing with the COVID-19. Ms. Salma, good evening to you. Can you hear us?
Yes, good evening, Mr. Abdullah. Salam alaikum.
Alaikum assalam. Can you tell us on the preparation of nurses and how do they support the hospital team work to provide support in fighting coronavirus?
Sure. First of all, thank you, Mr. Abdullah, for this opportunity. In the beginning, I would like to stress on the great effort that our government and the Supreme Committee for all precautions, missions, instructions sent to the public. We do trust that our people, surely they will adhere to prevent the spread of COVID-19. When we come to talk about the preparation and how nurses are or nursing preparing for in order to accommodate such challenge in every hospital, and I'm sure overall Oman, we started preparing nurses in terms of putting policies, guidelines, so in order to accommodate and able to train the staff. We started working in our strategy. We needed to modify some of our strategies in terms of manpower management, human resources distributions. We needed to collaborate with the primary health, school health nurses to accommodate them because a national status. So we have started training the staff, nurses in all the aspects to be with the infection control policy, for example, how to deal with critical cases, how to keep themselves safe, and we train them on policy implementation theoretically plus clinically. In terms of training, we needed to collaborate with the training department, and that is also most of the staff are nurses, so we have to train them successfully. And we play a major part in terms of monitoring the whole situation from 7 o'clock a.m. till next day 7 o'clock a.m. By assigning 2 supervisors their shift just to be the leader before hold the situation clinically.
What is exactly nurses' role in this particular situation? Can you tell us about it?
Sure. I think everybody aware nurses are the backbone of any health services. And they are the people who are already there. The moment you enter the hospital, the first person you see is the nurse. So the nurses are the people who triage. When we say triage, they're the people who receive the patients in the beginning. They filter the cases. They check when they meet the criteria or not. The moment they discover they meet the criteria, they guide the patient to isolation room, which is prepared for such cases. They do take vital signs of this patient. They reassure the patient. And they, like, if there is any blood specimen, for example, they communicate with the concerned professions like physicians, needed, the supervisors, the PRO, the security, if the patient, for example, required admission. And first of all, they will communicate with the focal point for COVID-19.
Great.
And from there, yes.
Great. What message then would you like to give to all nurses in Oman at this particular point?
Wallahi, I would like to, first of all, to thank all nurses overall for their great job, specifically for Omani nurses. Keep it up. You are doing a great job. Remember all the time that you are the backbone for the health services, and you are doing a great job. The whole scenario run with you. So please, we need you to be safe. Keep yourself safe. Maintain practicing the policy. Make sure that you do adhere to the policy and take care of your patients. And we know that you are up to it.
Ms. Salma, thank you very much for enlightening us on the efforts exerted by nursing team, of course, along with the other healthcare team. That message for nurses: you are doing a great job. Keep it up. You are the backbone of healthcare services along with other healthcare teams. That was a member of Nursing Association, Nurse Salma Salim Ali Al-Yaqubiya, head of nursing in Abri Hospital. Boris Johnson has tested positive for the new coronavirus but remains in charge of the UK's response to the outbreak. Johnson said today that he was tested for COVID-19 on the advice of the chief medical officer after showing mild symptoms involving a temperature and a persistent cough. He said in a video message that he has taken a test that's come out positive, so he is working from home and self-isolating. The government said that if Johnson is unable to work, Foreign Secretary Dominic Raab will replace him. Johnson has met in person with some senior ministers and officials this week and has appeared at press conferences alongside his top medical and scientific advisors. British Health Secretary Matt Hancock also has tested positive for the new coronavirus. Hancock has been at the forefront of Britain's response to the outbreak. Britain has 11,658 confirmed cases of the virus and 578 people have died. The number of deaths around the world from the novel coronavirus stood at 24,663. More than 539,360 declared cases have been registered in 183 countries and territories since the epidemic first emerged in China in December. Of these cases, at least 112,200 are now considered recovered. The United States has the highest number of infected people with 85,991 diagnosed cases and 1,296 deaths. Cases there have more than doubled in 4 days from 41,511 on Monday, making it the country with the fastest progression rate. Italy, which recorded its first coronavirus death in February, has to date declared 8,165 fatalities with 80,539 infections and more than 9,362 people recovered. Like Italy, Spain also has more fatalities than China with 4,858, as well as having 64,059 infections. China has to date declared 3,292 deaths and 81,340 cases with 74,588 recoveries. The country declared 55 new cases and 5 new fatalities since yesterday. The other worst hit countries are Iran with 2,378 fatalities and 32,332 cases, and France with 1,696 deaths and 29,155 cases. India has reported 724 coronavirus cases and 17 people have died. India is hoping that if it can keep its people under lockdown until mid-April, it would be able to stem transmission of the virus within communities. Other countries in South Asia, home to a fifth of the world's population, also signaled signs of distress. Pakistan, with the number of coronavirus cases near 1,200, has asked the International Monetary Fund for a fresh $1.4 billion loan.
Non-compliance with the directives of the Supreme Committee dealing with coronavirus COVID-19 exposes you to risk and legal action. Stay safe.
Indeed, stay safe, and all should follow the precautionary measures. This is the Sultanate of Oman television. Before we end tonight's bulletin, here are the main points once again. The Ministry of Health announces that the registration of 22 new cases of coronavirus COVID-19 infection for citizens. The Muscat municipality continues its efforts in dealing with the effects of COVID-19. British Prime Minister Boris Johnson tests positive for COVID-19, but remains in charge of the UK's response to the outbreak. And the number of infected people with COVID-19 in the US doubles in 4 days to reach nearly 86,000 with 1,000 deaths. With that, we do conclude this news bulletin brought to you live from this news center of the Sultanate of Oman television. Our message again back to you. Stay at home and follow all the precautionary measures. Be healthy at your home. Thank you for joining us.